What is molar pregnancy? Kia ora, Mary and Ben. Thank you so much to you and your husband for meeting me at such short notice. I received your blood test and scan results, and I'm sorry to tell you, but you have a molar pregnancy.
What's a molar pregnancy?
A molar pregnancy occurs when the egg isn't fertilized correctly. As a result, unfortunately, no baby has been made, and the cells that would normally create the baby's placenta have overgrown and taken over the space in your uterus.
So I don't have a baby inside of me at all? It's just a growth?
Yes, that is correct. I am so sorry. What the heck is molar pregnancy? In a normal pregnancy, one egg is fertilized by one sperm to develop into a healthy baby. However, a molar pregnancy is a rare disorder that occurs due to an atypical growth of trophoblastic cells. These are the cells that are responsible for developing the placenta. There are two types of molar pregnancies. These are a partial mole and a complete mole. Most molar pregnancies are diagnosed by an ultrasound scan. The ultrasound scan of a complete mole will show the uterus is filled with cysts and no fetus will be present. Ultrasounds of a partial mole may also show a fetus. However, this fetus is not viable and will be severely abnormal due to having 69 chromosomes. As some partial moles do not contain a fetus, the type of molar pregnancy can only be diagnosed through histology by a pathologist.
Why didn't my egg fertilize properly?
Sadly, Medi, there is no definitive answer to why molar pregnancy occurs. It is a rare condition. There are two types of molar pregnancies. In your case, due to there being no baby present in the amniotic sac, we are assuming it is a complete mole. This type is the most common type of molar pregnancy. It usually happens when the egg contains none of your DNA and a sperm has entered your egg and the sperm's DNA duplicates and fertilizes itself.
So what happens now?
Because I am not specialised in this area and I want you to receive the best care possible, I recommend transferring your care to a specialist. The specialist will be able to answer all of your questions. They will most likely suggest you have the placental products removed as soon as possible. This would be a day surgery and you would need to be asleep during the procedure. After the products have been removed, the doctors would then like to monitor your hormone levels through weekly blood tests to ensure that all the products were removed.
So you won't be my midwife anymore and I need to see a specialist?
Although molar pregnancy is out of my scope of practice, I am able to offer my support 2 weeks post your operation. You and your husband don't need to decide right now, but please feel free to contact if you need anything. How are molar pregnancies treated? In Auckland, women who are suspected or diagnosed as having a molar pregnancy are referred to the Early Pregnancy Assessment Unit in Epsom. The woman will be advised to undergo a dilation and curettage, D&C. This is a minor operation in which the abnormal growth is removed from the woman's uterus. During this procedure, the woman is sleeping under a general anesthetic, while a suction instrument is passed through her cervix into her uterus. After the products have been removed, it is then recommended that the woman has the type of molar pregnancy assessed through histology of the placental products. Understanding the type of molar pregnancy helps the doctors to understand how long the woman should receive follow-up care. Warning: this procedure is not a termination of pregnancy or abortion. However, it is important to acknowledge that the woman may feel sad because of the loss of her pregnancy. Even in most cases, there is no fetus. After the tissue is removed, the woman will have her beta HCG levels monitored through a series of blood tests. This is vital because the beta HCG hormone is produced by the trophoblastic cells in normal and abnormal pregnancy. In a normal pregnancy, there is regular growth curve that the beta HCG would follow. If there is a molar pregnancy, beta HCG levels increase abnormally fast because of the multiplying trophoblastic cells. Therefore, if after removal of the molar pregnancy, the beta HCG levels rise or plateau, it means some of the trophoblastic cells were missed. If a woman does not have the trophoblastic cells removed, she increases her chances of developing gestational trophoblastic neoplasia, or GTN. Disclaimer: we won't be going into detail about the different GTN conditions or how to treat them, as we don't have enough time, but treatment can be very invasive, including things such as chemotherapy and hysterectomies. The purpose of follow-up care is to ensure that if any cells were missed during miscarriage or D&C, the woman can receive prompt attention to have the cells removed.
Will this affect future pregnancies? And can I still have babies? We really wanted to start our own family.
You can still have babies, and your chances of getting pregnant again are the same as any woman who hasn't had a molar pregnancy before. It's recommended that you wait at least a year and until your follow-up blood tests are finished with a specialist. Also, because you've had a molar pregnancy, you're at greater risk for another molar pregnancy in the future. So it is recommended that you enroll with an LMC as soon as you discover you are pregnant, so that you can have an extra ultrasound scans done early on. Things to consider as a healthcare professional. Prompt treatment along with timely and continuous follow-up care is extremely important in preventing molar pregnancies from developing into GTN, a group of potentially life-threatening conditions that are caused by untreated molar pregnancies. The earlier a molar pregnancy is diagnosed and treated, the less likely a woman is to develop second trimester complications or GTN. Ethnic minorities such as Māori and Pacific Island women are 6 times more likely than European women to book latent pregnancy, putting them at a higher risk for complications to occur with molar pregnancy. Those of low socioeconomic status are likely to struggle with affording to attend the follow-up treatment, primarily due to cost-related issues. For example, the early pregnancy assessment unit that Auckland women are referred to is only open Monday to Friday from 7 a.m. to 5 p.m. Women would need to take time off work weekly. This would last for at least 2 to 3 months, then once monthly for up to 6 months for their blood tests. They would also be required to pay for parking at the clinic. It has been shown that women who live further away from their doctors and perceive the care to be unaffordable are less likely to attend an appointment when the care is needed. While it may be out of our scope of practice to go into detail about the woman's follow-up care and treatment, it is important that the woman understands the seriousness of her condition and the need for her to see a specialist for treatment. As midwives, we need to be able to recognize those who are at increased risk of developing complications and offer tests and referrals that may be of assistance to that woman.
Thank you so much for taking the time to explain all of this. We have a lot to think about, but I think we'll be in contact if we need anything.